This project has been in play for a very long time. 20 years plus they have been planning this project. Before, with the old facility, we were doing the best we could with what we had, and that is never something that anybody wants to say. It's a last resort. With this new building information model, as a 3D blueprint that is on everybody's tablet, so that when they need to go do a work order or any type of work, they know exactly. They can go to the spot, look above the ceiling and see right through it, and see what all mechanical, electrical, plumbing aspects are right there. If they need to get to a valve to shut something off, they know exactly where to go. We are a much more efficient facility with this new building.
The whole design came from 7th Gen, so we can't take credit for any of that. And Childers HKS kind of documented everything to get to a construction standpoint. So the design aspects of some of the window shapes and all that, it was all taken from the region. The large star that was in the center of the lobby is the Lakota star, so that was very important to them. So the lobby area, when you walk in, you look up and you're seeing the star. I thought that was a pretty neat design feature.
We knew that everything would be rooted in nature and beauty. And that's really meaningful to a designer, to know that that's your charge and to be so well aligned with that value. It was very inspiring. And knowing that we've impacted a community or the people that occupy the building every day, the staff, in a positive way, that's what we're going for.
I think the one thing that is important to remember is the relationships. The voice of the community guided the process, but it required Indian Health Service, the Great Plains Tribal Leaders Health Board, the tribes, even the folks that were involved in building the building and designing the building, to capture the essence of what we wanted to create and translate that into the overarching care that we're trying to provide was an art. And it was a commitment to relationships with all the people at the table.
One thing that was really impactful was the level of engagement that Flintco and others had involved us or engaged us in the process, so that we had a voice at the table.
Part of the influence of health through the built environment is incorporated into this project. Lots of natural daylighting, low-VOC products that don't have harmful off-gassing. You've got people that are coming there that could be their best day of their life and are the worst day of their life. You know, someone could be coming in there with their baby that's going to join them, and then you've got some people in there that may have developed cancer or terminal illness that are going there to get treatment. And this place is there where they can go from start to finish getting their health care. They don't have to go to a bunch of different buildings to get care. They come to this one place and get the care they need.
So I'm Tamia Doney, and this is Hawaiiampa Gallego, and I'm A'ani in Dakota, originally from Fort Belknap, Montana, and Hawaiiampa is A'ani and Oglala Lakota. With my first pregnancy, I started out with care on the IHS facility on the Pine Ridge Indian Reservation, and eventually moved up here to Rapid City, where I had to transition to receiving care up here. And transitioning into the new facility, it just felt very welcome, opening, fresh, light. It was definitely a different experience coming into the new facility.
You know, the building is done, it's here, it's solid. But I'm excited to think about the evolution of what we can do with the space. As the organization grows, as Oyate grows, as services change and evolve, I think that this building is going to be a testament of that continuous innovation and the continuous desire to serve our relatives.